I'm a surgeon, and I am a Google Glass explorer, and I really appreciate the opportunity to be here and show some of the vision, some of the potential for Google Glass. I'm a trauma surgeon, which means that I deal with a lot of ugly sort of type of injuries and disease, and advanced laparoscopic surgery. I have been given talks for the last year after I became a Google Glass explorer, and talks mostly related to wearable technology integration with healthcare, to improve, to augment healthcare. My first experience was as a TEDx speaker on telemedicine using a mobile device, and then since then I got involved with social media. I didn't even know what Twitter was, but now Twitter is the best way, the better way that I use to communicate and to get information. So I started a blog last year, and that blog also is my way of sharing what my thoughts are on innovation technology in healthcare. Then I went to Singularity University last year, did a program called Future Med, and it's called now Exponential Medicine. And that program really opened up my eyes because it allowed me to learn about Google Glass. And when I saw Google Glass, I thought, wow, this device has an incredible potential to improve the way we deliver and we teach healthcare. So my first experience, 2 days after I got my glass, I didn't even know how to use it. I came to Doctors 2.0 and had probably the first medical conference showing this cool device that could really help us do better. I spent a few days in Paris after that, and we came back to the US, and I did the first operation with Google Glass. I didn't do much, just went to the operating room, asked my patient and the family for permission, and was able to stream the operation from the perspective of my eyes, and stream it to a group of students that were interacting with me as they saw the operation, basically through the glass, but with my eyes perspective. I think healthcare is in trouble, and there are many reasons for that, and I think technology used in a smart way, innovation in technology, can really help us improve healthcare and also improve the way we teach healthcare or health or medicine to the new generations. Telemedicine is one example. Telemedicine, it's obvious. It's an intuitive way to expand the reach of doctors, the reach of providers, not just for providing care, but for teaching health. And a picture is worth 1,000 words. Well, a video is worth 1,000 pictures, right? So telemedicine makes sense. And now that we have a multitude of portable devices, from tablets to watches to glasses or whatnot, mHealth is sort of the new step in this regard. And we all know how common smartphones or cell phones are, more common than toothbrushes or toilets in most parts of the world. We have more cell phones and more lines of cellular connectivity than we have people in the world. So it is pretty obvious. We do have lots of visits to doctors' offices every day, but it is known that most of those visits do not need the touch of the doctor. So it makes sense that you use a device that allows you to communicate in every way but palpation, but touch with the patient to improve care. And that's where glass comes up. Glass is a device that really, to me, represents the natural evolution of the device, the natural evolution of the appliance. Just like we had big computers in the past. We came from big computers to small PCs to laptops to devices that allow us to, in a very small way, do what we need to do. It's not a new idea. This is Terminator 1, the movie. Head-up display. So this is a video that illustrates you similar features that glass has. Showing you a screen in your head that has digital information there, that can recognize features, that can give you data, and that you can input data to. So it's not a new idea. You see here how Star Trek and real life really correlate very, very clearly. And that's a way that is unstoppable. Technology develops exponentially. These are the first versions of Google Glass for a few years up to this current version, which is the first sort of a limited user available edition. And Google Glass is, again, the next step in the natural evolution of devices. This is a conference, everyone taking pictures with tablets or with smartphones. And, who doesn't have a smartphone? The weird guy is the one who doesn't look at the screen when you are waiting, when you are killing time. So that is pretty obvious. Everyone is doing this when they're doing anything. And, you know, a device that is wearable can change that, can facilitate the integration between the digital world and the way we act. So imagine if you had Google Now for healthcare. This is a video from Radboud University. Lucia and England allowed me to use this video, basically showing you on the right upper part of the screen the vision that you have on the glass screen, you know, the time, and then as you walk in the hospital, glass can recognize where you are, and as you get close to a patient, you get integration with a medical record, with the information on that patient, and allows you to then perform better healthcare. This is obviously a proof of concept, but this is doable. This is very doable, and there are some people who's already doing this. And as you walk and you do not even deviate your vision from the patient, you can really get all the data. And you can even do a telemedicine or a teleconsultation with a device like this. You got a lesion, you don't know what it is, well, you just connect with an expert who can be anywhere, you know, from the screen. And so it's very, very obvious, very intuitive that you could do this. So integration with the EMR is sort of the frontier that I think will revolutionize the way glass helps medicine and helps medical care. Disrupting data, not letting the data just asking data to come to you, but data coming intuitively to you, like in Google Now type platform, where doesn't matter what you're doing, if you need to know something, then intuitive flow of information to you will get to you. Disrupting data. We'll show later, you know, some checklists that glass can help you with.
Okay, glass.
And, you know, it's just facilitating the way you perform your daily tasks. We, you know, have been using the data, printed data for years, and we switched to electronic, but it's the same. We do the same sort of data flow, except we do it in a computer, so it's prone to errors. These are videos that I did using glass on a high-tech mannequin. Basically, letting someone who doesn't know very well how to do a procedure be guided by someone who's remotely located, like with telemedicine, telementoring. And I'm not going to go much into the length of the video.
I'm a PA. It's been a while. I need your help with this.
So I could be remotely located. In this case, I'm located just across the hallway. But I have glass, and everything he's seeing through, everything the iPad is showing me, I'm seeing on my screen.
Okay.
And then I can not just see a recording of that, I'm integrating myself with the actual act of the surgery. Students wearing glass can just tap the internet and ask for any medical information instantaneously that comes to their screen and answer a question. This is the way we taught medicine. This is the way we teach medicine still, looking over, you know, the shoulder of the surgeon. Now you can have the perspective of the surgeon, the point of view of the surgeon, very clearly shown to you, and not only a recording of that. It's not a recording, it's a real life. It's like being present, doing the operation. You're inside the surgeon's head, having the same view, not a tangential view, but the same view, and you can ask questions, and you can have questions answered by the surgeon as the procedure is done. So teleconsulting, you know, you can have a glass-to-glass teleconsultation, a remotely located cardiologist with glass, then connecting with someone remotely located with glass also, and having that connectivity with a wearable device, hands-free and voice-activated. So this disrupts the patient information. This disrupts the way we treat data. It doesn't. You know, privacy is an issue, and it's real. But I think that data is something that, like Denise have said in the past, patients want to be cured rather than secured in many ways. So lastly, I want to show this a couple of very quick videos on patient interaction. This is the way we do medicine these days, right? With a PC, immediately we turn away from the patient, and boom, disrupting that communication. If we do it with a tablet, same thing. We say hello, and then we immediately disconnect from the patient. Okay, start getting data and inputting data. So now this is the way we can do it with glass. Okay, does it disrupt the communication between the patient and the provider? I think that it enhances it, because you have all the information in front of your eye, so you don't need to turn away from the patient. You keep the eye-to-eye contact, and when you
Hi,
need
Mr.
to
Mayor.
input
How are
data
you?
or get data, you are getting it directly on your
I'm
glass
Dr. Grossmann.
without
I'm a
having to
surgeon.
turn
So
away
what
from the
brought you here
patient.
today?
So I think it has the potential to improve that. So it's a pleasure to be here. Hope you can try glass when we finish, and welcome again. Thank you very much.